fantastic opportunity there. So keeping it simple, the walking offer. A study has come out showing that 11.4 million people in this country would find that walking at 3 miles an hour a vigorous activity. They're so unfit, and this is 20 to 65-year-olds, we're not talking about elderly. So all you need to do, if we can get 11.4 million people just able to walk at 3 miles an hour, you've actually increased the fitness of over 20% of the population. Walking is a really simple offer. And it has to, what we're trying to find is ways of being innovative. It's got to be fun. It's got to be individually tailored. So the whole motivational interviewing side of things, of getting patient, where are you now, and where do you want to be, that's got to be a little bit more intelligent as well about how we do it. But the fun part has to be there. You know, we all know that. It should not be seen as exercise as a treatment and miserable. So very quickly on the last bit, I delivered this training to the GPs there, and we found that actually if you gave them the education and the knowledge, they had huge confidence in the importance of physical activity. And we've actually produced a booklet which is going to be launched by the NHS London tonight in draft form still, which has got all the evidence which is done for GPs, 350 references, which is going to allow them to have that evidence themselves. They can see what it's about. If you manage to get a small clinic in a practice, and we're talking about the bigger practices, we increased the referral rates to the outside world by 150%. It was once a week, it was a morning or an afternoon, it was run by one of the physical activity leads, and it reminded the GPs constantly that there was physical activity going on around, and it was a one-stop shop. And actually it increased to about 3 sessions in the end. This was done in Newham. We've talked about competence and importance, and then there's the whole technology side of getting that feedback to GPs. I think that's a whole area which we've got to work on. It's exciting. One of the areas of intelligent health we're doing is using smart cards to do that. There are loads of other ways of doing it, but we've got to start much more the technology to motivate patients, to monitor what they're doing, and that provides intelligent feedback to the GPs. Thanks very much.
Okay, great. Any quick questions for William? Yes.
It's not a question as so much as a point. Phil Insel from Sustrans. We've just been working with a couple of the public health observatories to produce a tool which will come out in about 6 weeks' time, illustrating the impact of physical inactivity on each local authority top-tier area. And I think it'll be a useful tool both in the setting that Craig was talking about, and then for yourself, William, in persuading the CCGs and the GPs of the scale of the local physical inactivity problem.
I think that is really important, but GPs have to see this as a problem first before they're going to be prepared to put money into it, make it a solution.
Anything else? Any other quick points? No? Okay.
I've got a great. Carl Bennett. I've just seen a tweet from a director of public health up in the northwest, and it reads: "The NHS is now unable to describe itself to itself. How are we going to describe the NHS to all of these people in this room?" And I think he's got a very valid point. I'm an NHS guy, public health commissioner, like Craig yourself.
Yeah.
But I think that's a real hot topic at the moment, and it's the ability to us to be able to tell people sat in this room how we're going to communicate with them, not how they're going to communicate with us.
Do you want to describe the NHS then?
What have we got? I mean, I'm finding it hard to explain it to myself, let alone to anyone else. I mean, from a primary care side of things, and I'll only talk about the CCGs. They're obviously kind of developing. There won't be statutory until 1st of April. As you probably know, GPs are going to cluster together in groups, and then the clinical commissioning group will be headed by a GP and an assistant, etc., and they will set out the commission of the budget for what's going to be spent on those patients there. In most London boroughs, it's 1 CCG per borough, but there are actually quite a few boroughs that have got 2 or 3 where GPs have fallen out, and then people still haven't worked out what the boundaries are, so there's still lots of uncertainty. As far as what we should be doing in the NHS is the patient. We should be starting with the patient and actually saying, if I'm a patient and I've got diabetes, I want to know how I'm going to become physically active. And if we start with the patient and put that journey, I think that's the best way of describing the NHS.
Yep. And my kind of response to that question is, if you come across anyone who can honestly say to you that they understand the new system and how it's going to work, they are deluded. And we're in serious difficulty because the only person who did understand this was Andrew Lansley, and he's left. So it is really, really difficult to see how this is going to work. And part of the difficulty is the time span that it has taken to get us this far. Tomorrow week is the 2nd anniversary of the publication of the white paper on public health, and it's taken us years to get this far, and we haven't even made the move yet. So, and you know, a serious problem, and I've been through 7 previous restructurings in my career as a regional director of public health. And at each stage of those, we lose about 30% of the skilled and experienced people in public health, every time. And there's a real deficit then to be made up, and it takes us time to get those skills made up. So which are all reasons why I quit the Department of Health at the end of March this year to do other things. I'm director of WHO Collaborating Centre for Healthy Urban Environments in the University of West of England. I'm Professor of Public Health Planning. And I have a particular interest in the built environment and its contribution to physical activity, which I think is absolutely enormous. Just to some of the difficulties I think that we have around physical activity came up this morning. One is the definition. Both Andy Burnham mentioned, both he and Jeremy Hunt have both made the transition from DCMS to Department of Health. One of the difficulties we have is that those 2 departments have different definitions of what it is to be physically active. And when we can't even get agreement across government about what that means. For example, I used to always get very cross with colleagues when I was in Department of Health and DCMS, because according to their definition I wasn't physically active. I might have cycled an hour every day to and from work, but they didn't count that as being physically active because I had to take physical activity in my leisure hours before they regarded me as physically active. So we have a real difficulty, I think, to find good definitions at a local level about what constitutes physical activity. I think the second issue is measurement, and that's come up several times. Will in particular in the slot for lunch mentioned that. And one of the things I must caution you against in this whole arena is self-delusion, because it is rife. And it was really brought home to me by the Health Survey for England, which is probably the best survey we have about the health of the population of the country. It happens every year. They do different kind of things every year. But it's a huge sample size, about 16,000. There's a questionnaire. The last time they looked in detail at physical activity was, I think, the 2008 or 2009 survey. And in that it was recorded that 39% of men and 29% of women indicated that they took 5 times 30 minutes of physical activity a week, thus meeting the CFO's targets. And they took a subsample of that and attached accelerometers to them and found the true figures were 6% and 4%. So when people quote to you data about physical activity, you've got to treat it with enormous caution. Though the really interesting thing was when they did the same study on children, they found children told the truth. It was only the adults that lied, and I think part of what we've done with Change for Life is tell people the right answers to give to questionnaires. If you tell people often enough that the right amount of fruit and vegetables to eat today is 5 portions, when you ask to give them a questionnaire, they will tick the box for 5 portions of fruit and vegetables. Will tick. So I think we're producing responses to questionnaire. So I think we have difficulties of definition, difficulties of measurement, and there's no reason why we can't overcome some of these difficulties at a local level. One of the things that was hit that we lost was the active travel survey. There's a school census carried out three times a year, I think, by the Department of Education, and there was a module in that Department of Transport module which looked at children's mode of travel to and from school. For example, I know in my city, Bristol, that 34% of the primary school children travel to their primary school by car. Now in future we'll not know that, because I really want to know that, because that is very useful data to sit alongside the way in measuring data, and I regard it as an absolutely shameful thing. And I think all discussions about including more physical activity in the curricula should be preceded by a discussion about how the children actually get to and from school, because that for me is the way to deal with it. So I think we have issues around that.